Please welcome Doctors Mitesh Borad and Angela Lamarca. And Stacy Lindsay.
Thank you so much. We've had a great couple of days, and today we have a really exciting agenda. I am just so thrilled with how things are going, and so excited to welcome the regulators and so many of you from international areas all over the world. Thank you for being here. Just a couple of housekeeping items. First, be sure to post on social media your experience here in the conference, and you can share that using the hashtag CCFAC24 and CCA Hope. And let's help us spread the word. Just wanted to remind you about the store out front. If you would like to get any items, feel free, that's available to you. Also wanted to let you know if you want to participate in the GWAS study. I participated yesterday. And everyone in this room, everyone here can participate. The researchers, the scientists, the patients, the caregivers, the regulators, everyone can do that. It's down at the end of the hall, the GWAS room. The Mayo team is here and other volunteers. Melinda's husband is one of the phlebotomists that's helping us. And it's located in room J, but they will only be here till noon today. So please help us to keep that research rolling. Also wanted to remind you about the giving tree outside. Thank you for your support and your help so that we can get more research rolling. Also wanted to remind you about the service projects that are available. Today we're writing cards at the CCF tables, which are out in the front lobby to your left. These go in the newly diagnosed kits. And so you can imagine, you and most of you know and are aware of sometimes the anxiety and the fear that are just intrinsic to a diagnosis of cancer and then a rare cancer. And this is a note that you can write to someone who's going to get a free care kit when they come into the newly diagnosed portal. You can just write them a little note of hope. So thank you for helping us do that. I want to introduce our first speakers. We're going to hear a patient perspective and CholangioConnect. This is Fred Neubauer and Vincent DiMauro. So Fred is 69. He is a retired sales manager from a specialty chemical company. He was diagnosed with stage 4 intrahepatic cholangiocarcinoma in 2019. He underwent a year of chemotherapy followed by precision radiation and targeted therapy. He also underwent microwave ablation for 3 tumors. Fred enjoys swimming, DIY home improvement, and renovating a 1968 Triumph Spitfire Mk3. He finds fulfillment in watching his 3 grandchildren grow and volunteers as a mentor and advocate for the CCF CholangioConnect program. Vincent is known for his exceptional listening skills and strong communication abilities. They make him an ideal mentor for CholangioConnect. Beyond his mentoring role, he enjoys spending time in the kitchen, baking sweet treats for his wife and 3 children. Vincent is also actively involved in volunteering at his children's school, demonstrating his commitment to both family and community. So let's welcome Fred and Vincent.
Hola, good morning, ni hao, and good morning, everyone. I have a PowerPoint presentation prepared, not for you, but for me. My children's oncologist diagnosed me as ADHD at the age of 45, so I need this so I don't get distracted by squirrels. So I have no disclaimers, but I do have a request at the break. If there's any radiation oncologists that write the reports, I think I, along with a lot of people, would like to know what an unremarkable tumor is, and I hope you understand. I know we do. And I live in Alabama. We don't believe in the metric system. So if you could size relate, something we have visual. For me, you know, a 3 by 3 by 3 centimeter tumor is a Titleist golf ball. And my largest tumor, which was 17 by 8 by 7, is 4 sticks of butter. Here we go. I've been a patient mentor since spring of 22. Patty Maxon asked me if I'd be willing to volunteer. I later found out that my oncologist encouraged her to ask me, so I'm very appreciative in the long run. I currently support, that's changed since I've been here, I'm up to 10, and that includes 2 mentors I've lost, mentees that I've lost that have passed on in the last 2 months. And I'd like to, I don't think anybody's mentioned a real warrior for us, and that was, Jill, help me. No, UAB. Who passed? Marissa Wilson, I apologize. She was a strength and a mentor to anybody that's been involved in the CCF for quite a while, and she passed earlier this year. My role as a mentor is to offer support, general knowledge to prepare folks for what's going to happen, and offer my experience. And I think you heard that I've had a lot of work done other than surgery. I've had a lot of it. First question people ask is, why me? And I stay active, I'm physically active, I eat right, and I first tell them that if anybody's a candidate for cancer, it was me in my career. The chemicals I supplied, the chemicals I worked in plants such as refineries, specialty chemicals, and paper mills are very toxic. And any physicians out there will recognize a lot of these as extremely aggressive and potentially cancer-causing. So the why isn't important. The what are you going to do going forward is, and that's kind of what I preach as a mentor. I'm a Christian. I try to deal with my patients similar to Apostle Paul in his letter to the Corinthians. In chapter 13, he preaches faith, hope, and love. And that's kind of a pillar of strength in this foundation. He wrote to the church he started in Corinth that had busted up and fractured into 4 different groups. And he said, get back to the basics, faith, hope, and love. And this can also be equated to the secular world, which I'm going to be talking about. Faith from the standpoint of what has been accomplished and what is available to us now. Experienced oncologist, you need to find one. The foundation has all the doctors that they recognize as subject matter experts available online. Proven treatments are out there that have, just changed rapidly over the past years. Chemotherapy, chemo blends with immunotherapy, which wasn't even available as a primary treatment when I first was diagnosed. And obviously, targeted therapies, which I'm on now, and then surgical techniques and et cetera. And all these are available through the foundation, through your mentor, or just becoming more active. Hope. that's the exciting advancements coming forward. The clinical trials, I try to emphasize people to consider, because you get the best care possible. It's frightening to think about doing that, but you really do. And if you talk to anybody that's been a patient for clinical trials, you see exactly what I'm talking about. IR therapies are out there and soon coming. Our histotripsy, which I'm extremely excited about, and also something that hasn't been discussed much is alpha DART, which is a new form of radiation at McGill University. They're studying it on liver cancer. Then obviously, surgeons out there are now willing to assume more risks to help us out. The greatest of these is love, and that's why I chose to be a mentee. It requires a lot of listening and patience to understand what emotionally and physically the patients are going through. Being truthful. We aren't doctors, and we can't give false hope, but our experience can help calm down and give comfort to the patients that we're serving. Commitment, it is a commitment that you have to be willing to accept as a mentor. I'm all in is a motto with Auburn University, where my daughter attended, and as a mentor, that's my philosophy. And anybody that's been a mentee of mine, Vincent can attest, I get engaged. I'm going to try to talk to them as much as possible. If they can't, I'm going to text them, and we're going to communicate monthly or bi-monthly. Mentoring is more than just assisting. It's a relationship building. Vincent and I are fellow warrior brothers, but we are also very, very good friends, which is going to last our lifetime, which we hope will be extended a long time. All that's great, but hope is not a plan. My first sales job, when I actually turned in my first proposal, my boss asked me, "Fred, how are you going to do with this? Are we going to get the business?" I told him, "I hope so." Wrong answer to your boss. He said, "Fred, hope's not a plan." And that's what I stress to all folks, particularly cholangio patients that are stage 4. Technically, at this point in time, we're incurable. We've got to fight for ourselves. You need to get a second opinion. Any good oncologist, once you start getting treated, would encourage you to get a second opinion for 2 reasons. Number one, you learn what other options might be out there. But number 2, it verifies, and they'll feel comfortable with the other oncologists that you see are probably going to say you're on the right track right now. Apologize if I'm having issues with my vision. Treatment decisions are up to you and your oncologists and your caregivers. But you need to be the driver, because you own this cancer. It's yours. And don't be afraid, again, to consider clinical trials at the right time. My team is critical. My wife, Jill, is my rock. She's my manager. She's my caregiver. And she's been the love of my life now for 42 years. And Jill, I got it right, so you can't tell me I don't know what I'm doing. Family. Photograph of my family. My daughter and her husband have 2 grandchildren. We have 2 grandchildren from them, Jacob and Anna, and then my son David and his wife Hannah have a 1-year-old son as well, so I've been blessed. Oop. I'm also treated, I'm treated at MD Anderson, but I get support at the University of South Alabama Mitchell Cancer Center. This is their team, Dr. Abdallah, Nurse Jamie, and physician's assistant Jamie. One of the issues with targeted therapies are they can cause some issues with vision, which I'm subject to right now because that screen's very fuzzy. I routinely, every 2 months, see a retina specialist, Dr. Stuart Ball. I'm teaching him about targeted therapy because this is new to local physicians that examine eyes. They aren't aware of it. And I feel like I'm an excellent trainer in giving him support. I have to thank Insight and also Teheo. They have given me quality of life that I'd never expected for the almost 3.5 years now. And for all the researchers out there in pharma companies, all of us cholangio patients I know are most appreciative of your effort and involvement with the foundation. And all the researchers and pharma companies, if you would, please everybody acknowledge them with an applause. MD Anderson, I can't say enough about the facility. This is my primary oncologist, Dr. Milind Javle, and his staff. He and I have developed a plan going forward. I like to push him a little bit, but he's the boss, and I follow his directives, but I love the fact that he listens to some of the crazy ideas I come up with and tells you, slow down, Fred, I got a plan. Dr. Eugene Coyne, I think he's going to be here as my radiologist, and he took that large, in Alabama, the 4 sticks of butter in that sucker is now destroyed. It's scar tissue, and it was encroaching upon my hepatic vein and my main bile duct, which any of you with the large tumors like that getting near there, it's not a good sign. And that's why I'm up here today, is because of Dr. Javle and Dr. Coy. And that's what I live for. They're giving me the opportunity to watch these youngsters grow. And I'm hoping that maybe number 4 will be on the way, but they call me Opa, which is German for grandfather. And that's why I'm here. And I'm going to fight forever. I'm going to support the mentees out there to give them hope. My glass is always half full, not empty. And I like to think that I give the right kind of advice to push for treatment, particularly for stage 4 patients. I want to thank all the cholangio warriors out there. I want to thank my mentees because they give me comfort and support as much as I do them, and we need to keep fighting. I'd like to thank several people out there, my brothers and sisters and their family, my brothers from another mother, Mark, Dan, and Ted, my Neenah boys, who they know who they are, from Neenah, Wisconsin, that I grew up with, and the early family, who's also like part of our Neubauer family. I don't want that for any questions. That shouldn't be on there. And lastly, I'm challenging them. I assume this video will be out in a month, and I'd like to challenge them all to donate to the foundation, and Jill and I have agreed that we will match their offer up to $5,000. And And if any of them work for a major corporation, they typically have set up a group that will match their contribution. So make sure you contact your corporation and let's double that effort. And with that, I'm going to turn it over to Vincent, my mentee, who also is my mentor and also an excellent friend.
Thank you, Fred. It's funny, it's very bright up here. You don't expect that. So I want to start out by saying, I'm lucky. The reason why I'm lucky is not because of the amazing support I get from my family, the doctors, the nurses, but I'm lucky because there was something missing. There was something missing when I was after being diagnosed. I had all that amazing support, of course, but there was always something missing. Something that I could relate all that I'm going through with someone, having a connection with someone that, we're going through all the side effects. It's troubling sometimes when one week you're doing well, the next week you're not eating as much and you don't know why, and why am I not craving anything? Why am I losing weight? And that's when having a mentor was so important because it filled that void. Obviously, Fred was so helpful in filling that void. He, whenever I had a question, whenever if I had a mouth sore, if I had my neuropathy was getting worse, I had someone to reach out to and relate to and ask those questions that maybe the support I had couldn't answer. He was so helpful in also warning me, hey, you're starting foodie-batinib, these are the things that I dealt with when I was on a similar drug or when you're on foodie. So we could bounce ideas off each other. But the most important thing, I think, for me is, and why I'm lucky, is because I found and stumbled upon getting a mentor. It took a few months. I was hesitant about, filling that form out to get a mentor because, you don't know what to expect. It's, who are you going to get? Obviously, and I keep saying I'm lucky because I found Fred and I found that person where I could complain to and know that he understands and he's there to listen. So for me, my perspective of having being a mentee is something that's just, I don't know where I would be without it, honestly. There's just all the feelings you get. They're all new feelings, when you have cancer, and you don't know how to navigate those feelings. And Fred was there to help me navigate them as well. So I thank Fred for that, and I thank Cholangiocarcinoma, the foundation, for having this amazing space where people like me at the time when you needed help and fill that void, you were able to fill that form out and get a mentor that will change, the perspective of how dealing with cancer is. Thank you, Fred. Thank you. So, after learning so much from Fred, I was really motivated to share that experience, and that's when I became a mentor. Fred pushed me, he goes, gosh, I think you're ready. Because I was, of course, helping him in his situations when I'd ask him how he's doing. So I had a little practice on mentoring with Fred, and I learned so much from Fred, but I also learned that as a mentor, being patient, and the listening skills that go into it are very important. I realize that the most important thing as a mentor is also listening, understanding how to ask the right questions, trying to, not push to get the information out of someone. It's more guiding them. Did you get your second and third opinions? Did you load up all your scans to which I'm blanking on the name of the Citizen? Thank you, Jill. But what I learned is starting off slow works well. You want to build that connection. You want to build that trust. It's so important to have that trust, and learning how to build that with the mentee, I think, is so important, because that's when you naturally want to, kind of, hey, this is what I'm going through as well. But I mean, all of it's invaluable. I owe so much to Cholangio because of this opportunity to mentor as well. Like Fred said, it's, you almost become you become friends. Fred is one of my good friends, dear friends now. My other mentees that I have 3 mentees now. Unfortunately, I lost one over the summer, and I'll tell you, that really hit home. That really showed me how much a mentor means to a mentee. His name is Juan. His wife, I was talking to him weekly. He was telling me everything he was going through. He felt bad. He's like, I don't want to bother you. I'm like, no, please bother me anytime. And his wife texted me and said, hey, just want to let you know, unfortunately, Juan passed away. And that but was so big. She said, you made such a difference in the short time that he talked to you, and his eyes would just open up whenever I called, because he knew that he could have someone to relate to and have a connection with. And that's it. I just want to thank everyone. I hope across the internet we can make a difference and get more mentees signed up and more mentors signed up. And if anyone has any questions, please reach out to me. I love this community. It's my second time here, and I tell you, from the moment I walked in, and I know until I leave today, there's just a special energy here that's been created, and I thank everyone for bringing that energy here and sharing it, and I love you all.